Nous allons maintenant entendre Brad Parsons. Je vous le présente brièvement. J'ai eu le plaisir, grâce à Sylvain Landry, de le rencontrer à l'hôpital qu'il dirige à Jonesboro, en Arkansas. Alors, c'est un hôpital qui est dans un système plus large, qui est le Northeast Arkansas Baptist. C'est un système de santé intégré. Et l'hôpital que M. Parsons dirige est dans le nord de l'État d'Arkansas, et ça couvre à peu près 3 États américains là, autour du Tennessee. Il est président-directeur général de cet hôpital depuis 2012 et a également été nommé président-directeur général du groupe médical de ce même hôpital à compter depuis 2015. C'est quelqu'un qui a publié récemment un bouquin qui sera disponible d'ailleurs au kiosque quand vous sortirez à la pause et pour le 5 à 7. C'est quelqu'un qui a beaucoup réfléchi en passant d'une pratique de gestionnaire formé dans les grandes écoles de l'administration, à la fois des affaires mais aussi de la santé, et qui a réfléchi à de nouvelles façons d'amener et son groupe et son hôpital plus loin. Aujourd'hui, il va nous entretenir de Creating an Effective Management System, Integrating Policy Deployment and Kata. Je vous demanderai d'accueillir Brad Parsons.
I got to travel with my wife and my daughters who are here today, and so we have thoroughly, oh, thank you. We have thoroughly enjoyed your city. We came Friday and have very much enjoyed Montreal and hope to come back in the summer. The summer might be a little bit nicer. But very good culture, food. Thank you so much for hosting. A special thank you to my friends. Thank you for the introduction, Daniel, Jean-Marc, friends that have visited from Montfort, and a special thanks to my friend Sylvain for the invitation. What an honor it is to be here today to talk to you about something that I'm passionate about, and it's about the work that we get to do every day. And not only the work that we do, but how we engage people in that work. And so we talk about creating an effective management system. And we'll talk about that today and what it means. But the first thing we do, and we talked about this at length this morning, was the fact that oftentimes we're trained to be implementers. Anybody in charge of implementing something? But what we really need to do is to be experimenters. And so we'll talk about how the Kata thinking pattern helps to be experimenters in what we do. So rather than implement, rather than knowing what the answers are, it's our job as leaders to experiment our way forward, to go into the unknown, not knowing exactly what all the answers are, even though we think we know what we don't know. And so it's always helpful to put draft in front of my presentations because it sets the tone for this is another experiment as we continue to learn together. You heard a little bit about our organization. The Baptist organization is based in Memphis, Tennessee, and we have 22 hospitals across 3 states. We have states far-reaching. We're the largest healthcare provider in the state of Mississippi. We have lots of hospitals close to where we're headquartered in Memphis, Tennessee. And I am the CEO over one of our hospitals in Northeast Arkansas. And so there's a zoom in so you can see Memphis on the map. You can also see northwest of Memphis, the smaller star is Jonesboro, Arkansas. And a zoom in there of all of our points of access in northeast Arkansas. A more rural area. Jonesboro is a town of about 100,000 people, has a university in Jonesboro, Arkansas, and 2 health systems there in Jonesboro. So this is a little bit about our clinic. We have an employed medical group of 110 physicians across 30 specialties. We have now about 85 advanced care providers, nurse practitioners, CRNAs, physician's assistants. This year we'll see over 400,000 patient visits in NEA Baptist Clinic, and we're the largest multi-specialty group practice in our region. Our hospital is 230 beds. We moved into this facility, a brand new facility, in 2014. We've had 3 expansion projects since we've opened, and we have the capacity for 300 beds in this facility. It's designed with patients and families in mind to really create ease of access. But I'll pause and say here that even though this new facility and several beautiful facilities here in Montreal, moving into a new facility does not solve any problems in our healthcare system. We thought that our new facility would solve all of our problems. We move into the new facility and everything would go beautifully. In fact, when we moved into the new facility, it precipitated the change in how we think. It precipitated the need for a management system. So my question to you today is, how do you think about your management system? Now, embedded in this question is the point that all of you are working inside a management system today, regardless of what industry you're in. It doesn't have to be healthcare. Regardless of what level you are in the organization, there is a management system at play in the work that you do. And our talk today, I want to challenge you to think about what are the elements that make up your management system, and how do you think about those elements in what you do? So the system could be as simple as these 3 bullets. Purpose. What is your purpose? Why are you there? What are you trying to accomplish? The people that you have, how many? What are the key roles? And then what processes are you actually trying to achieve? It's that simple, right? Easy. In fact, our systems oftentimes look more like this. And in healthcare, I believe healthcare is the most complex system we've ever created. Now, we've talked this morning about a lot of similarities between the American healthcare system and the Canadian healthcare system. And there's also lots of differences between the Canadian healthcare system and the American healthcare system. But I think it's safe to say that everybody agrees that the system is extremely complex. And so how we organize and think about this complex system is very important. This is what our federal government thinks about the healthcare system. Does this resonate with anybody? The government believes that our system is this kind of complex, with lots of lines moving in lots of different directions. And the government still only plays a portion of the American healthcare system, a large portion, but only about 65% of our healthcare system comes from our government. This is how many of our managers feel, and maybe many of you feel as leaders in the healthcare system. So this poor guy is trying to stop all the water that's coming out of this dam that's about to break. And I believe in my core that managers in healthcare today are among the most passionate people in any industry. Healthcare leaders got into healthcare because they wanted to serve, because they wanted to do well by their fellow man. And this is the situation that we put many of our leaders in today. The feeling of frustration, the feeling of loss of control, the feeling that they can't make a difference because they're trying to move and stop the gap somewhere. Oftentimes we call it putting out the next fire. It's my belief that so emergencies will happen, and we must be able to stop and drop and respond to the needs at hand. But we cannot be firefighters every day and expect to improve the product, whatever our product is. For us, it's the product that we have for patients and families. Our leaders cannot be firefighters and make progress in the care of our patients. We have to get out of firefighting mode. And so we've created, with a lot of help from a lot of people, the Baptist Management System. This is a system based on principles that we believe in, that are true whether we believe in them or not, but that make a big difference in the care of our patients and their families. And I want to talk about these principles here a little bit on the screen. So we believe that it starts down here at the bottom with culture. We talked about these principles this morning as well, but this starts with respect and care for all people. Again, we're in the business of taking care of people's lives, and so respect and care for all people. But it also applies in organizations to how we work with each other. We also believe in the principle of humility. We have to lead with humility. What is very important to us as a faith-based organization, so we're an organization that our mission statement is the threefold ministry of Christ: healing, preaching, and teaching. And in that mission statement, a principle that we pulled out is the principle of empathy. And so we believe with respect, with humility, and with empathy, you have the privilege of earning trust in the people that you work with. And it's with those four principles that create the kind of culture that we all want to work in. When you have the kind of culture that you want to work in, you get results. And for us in healthcare, it's results for our patients and their families. I use this slide all the time. I use this slide continuously with my team at NEA Baptist because it takes continual recentering on the principles that we believe in and why we do what we do. It's our responsibility as leaders to talk about those principles all the time. And so what we've seen in lean implementations, again, and I'll use that word, is we see lots of tools, we see lots of events, and we see lots of programs. I want you to look at the quote. The difference between successful and unsuccessful efforts was always in the organization's ability to get past the tools, events, and programs and to align a management system with principles. We believe very strongly in this. When such alignment took place, ideal behaviors followed and perpetuated a deep culture of operational excellence. So in my 20-year career in healthcare, I believe that there are passionate people that want to have a deep culture of operational excellence. They're driven to get great results, not today and tomorrow, but next week, next month, next year. And so I believe it's in that passion that we have to connect to a management system based on principles. I believe it's core to our management system and how we think about the work at hand. This is a picture of what that looks like in our organization. And so, and we ran an experiment with this. This is still up in our hospital today, but it took several years for people to really pay attention to it. And that's because everybody's busy, and we'll talk about that as another key element of our management system, but individuals are extremely busy and doing everything that is in our busy lives. And so this was a way to pull out the principles and have them in front of employees. This is the employee hallway where they all come into work. They have the principles and also smiling faces of employees that are working in our organization to remind us of the important work that we do and that there's lots of different roles and lots of different people doing that job in our organization. This is a little bit how we think about our complex management system. So it's our responsibility as leaders to simplify that system, and we talk about purpose, people, and process, but it's still very complex. We use the principles that you see on the right, but we also use all kind of tools and systems to supplement that management system. And I'm going to talk about some of those today and how we think about each of those categories of the management system. So, and this is an event where we talk about the importance of Kata. And I'm here to tell you that Kata is the driver for our management system. And we want to talk about how we think about Kata. But Kata really is the thinking behind the work of our management system. And it's critical because, as Sylvain mentioned, we have to change the way we think. As human beings, we have to change the way we think about the work at hand. We have to give ourselves time to improve the work that we do. So, and it's not just focusing on the work. Improving the work is the work. And we talk about that. Oftentimes in tools, events, and programs, you see an improvement department off to the side. It's our job to bring that into the fold. It is the work that's at hand. Everything that we have to do has to think about has to have this thinking pattern in what we do. So this is what we've done to Kata. We've baptized it as a Baptist organization. You can see this is our logo, our vision statement, or our vision and our challenge. And then we come back over here to our current condition, and this is where we PDSA across into successive target conditions. So this is this thinking pattern that we take in every element of our work. So the blue brains that you have, everybody got a blue brain, but your brain is the nervous system for your body. And we believe that Kata, the thinking pattern, is the nervous system for our management system. It infiltrates everything that we do in the management system and has really begun to be applied in every tool that we use. We are using the Kata thinking pattern. So this is something that we use and has really helped us as we roll forward. It's easier to act your way to a new way of thinking than to think your way to a new way of acting. So I started talking about an experimentation mindset, and this is a quote that is very influential for us. So this quote helped us to take one step forward, to advance our thinking just a little bit by running one more experiment, to make sure that we continue to move forward into a new way of thinking by making an action, by making sure that we were running an experiment. We also use strategy deployment as a key system to our management system, and it helps create alignment in what we do. Strategy deployment, many of you are using, and I've seen great examples of that today. I consider it the anchor system to our management system. This helps get everybody on the same page, to have clarity about what is happening. We had the privilege of going to the Children's Hospital St. Justine and seeing great work by the neonatal intensive care unit and having their huddle boards that is for all of the 300 team members in that department, they get to know exactly what the work is and how that work is progressing. This is what our strategy looks like for NEA Baptist. I use this slide almost in every presentation I give to frontline staff members as well. This is our strategy. We think it's critical that every employee knows exactly what our strategy is. We want to deliver the right care at the right time, at the right place, and at the right cost. Now, that can be defined differently for lots of different departments, and that's the point. This applies to every single department that we have in the organization. They might not have a strategy active in all four, but every department in our organization can connect with one of these strategies for the organization. This is our strategy because this is what resonates with our customers, what our patients and families want out of the healthcare system: the right care at the right time, at the right place, and at the right cost. This is a little example of what this looks like in our organization. And so in the book with my co-authors, we talk about the gear train analogy of making sure we have alignment across the organization. And so the gear at the top, a slight turn in that gear at the top can make the gears at the bottom spin a whole 360 degrees or sometimes more. And so as one of the other principles that we use is having constancy of purpose, to make sure that to be respectful of the employees in our organization, we have constancy of purpose in what we do and what we talk about. So we have a series of huddles across the organization, and they're usually monthly. Sometimes they end up being weekly huddles to make sure we hit all shifts. But this is what has been implemented and is probably very familiar with you from my understanding of the Canadian healthcare system. This has proven to be very effective because of the alignment it creates for our management system. And again, it's important that we talk about not just the fact that there's a huddle board, but why is there a huddle board and who is the huddle board for? So that's important. It shows respect and it's humble by me going to a huddle board and learning about the work at hand in a specific department. It helps create alignment as well. This was taken this is one of our original Obeya rooms. This is our war room and one of our original boards when we started. This is also a Kata for us. So this today looks a little different. And you can see the evolution that we've done on our strategic huddle. So we've added strategies. There's more strategies to accomplish the work. There's a lot more visual management. And I will tell you, the visual management is a lot sharper than it used to be too. You can see more strategies and more visual management as we learn more and as we do that iterative thinking at the very top of the organization to continue our improvement efforts. So, like I said, we meet on a monthly basis. This was taken this past week when we were doing our monthly cadence. I was sitting in the chair there. I just stood up from the chair and backed up and took a picture. You can see a physician on the right-hand side of the picture and some of my team on the left-hand side. That's our HR director talking about how we're improving employee safety by reducing injuries for our employees. Also, how we're increasing leader development, which we'll talk about a little bit more. So in our monthly cadence, we simply say, where are we? Where do we think we would be? What did we learn? And what are our next steps? Does that sound familiar? Where are we today? Where do we want to be? What are the obstacles in our way? What did we learn, and what are we going to experiment with next on our way to our challenge? So you see that thinking pattern that is in a different tool and system for our management system. How many of you are familiar with TWI? Some hands. TWI is another kata, and it's very important. So I put this slide up here. We're very proud of this at NEA Baptist. If anyone in healthcare picks up the TWI material for job instruction, for job relations, or for job methods, all these pictures are from NEA Baptist. So if you pick up those, we helped healthcareize TWI for healthcare, and very proud of that work. So we use all three of these elements as key aspects of our management system. This is an example of the job relations card on the right and the kata card on the left. And you can see how similar it is when you talk about the routines, the mental exercise, and the routines that we do. So when we deal with people, job relations is all about how we deal with people. We want to get the facts. We want to sound similar to understanding our current condition. We have to weigh and decide. We have to determine what the next steps are. We have to take action and then check results. And so you can see the influence and the similarities of TWI and the kata thinking pattern. We're very passionate about leader development. And so we have shepherds groups, and we use the term shepherds because they help oversee the alignment and deployment of the work. And so they help also develop our leaders for the future. So I am constantly talking to my leaders and my team about how to engage their teams. It's important that we continue that engagement throughout the organization. We have 4 distinct shepherding groups at NEA Baptist. We have a kata shepherds group, who are really the coaches and the second coaches for all the kata activity across the organization. We have a job instruction and job methods shepherding group. We have a job relations shepherding group that has really developed a process to ensure that every leader in our organization is trained in job relations, and we have a check and adjust cycle on that. So that has been very influential work in our management system. And then we also have idea generation and a shepherding group to help spur idea boards throughout the organization. We have about 40 idea boards that help really get bottom-up ideas from frontline staff members to help improve the work that they do on a consistent basis. But we've also used the shepherding groups in a very specific way. And this is an example of our Kaizen events at NEA Baptist. So we have worked with Brandon Brown, who many of you might know. We've also worked with Skip Stewart, who is our Chief Improvement Officer at Baptist. And we created something called the Get Better Jump Start. The Get Better Jump Start is a Kaizen event done kata style. And so we do successive kata cycles We prepare for 8 weeks for the event. We actually do the event in iterative kata cycles. And we have done this with great results. So this is our rehab unit. You can see we had an audit from our government, and we didn't do very well in that audit. And this was very important to us. And so the goal was at 75. We started the Get Better Jumpstart, and then since that time, we have maintained all of the audit results that's expected of the government to make sure that we get paid for the service that we provide to our patients. So this kind of success is really critical to our health system, and this is another great example of that. So over the course of the Get Better Jumpstart, of the Kaizen event that we did 32 PDSA cycles. 21 obstacles were identified and eliminated. We left that Get Better Jumpstart with 2 brand new job instruction breakdowns that all the staff were trained on to ensure that this was done correctly and maintained. And 4 met the target condition on 4 focused processes, and then 2 started today. So there were 2 kata teams that did that iterative work, and this was my favorite part. This work advanced our work 10.5 weeks into the future. So for anybody in a leadership position, think about being able to catapult the organization into the future by doing work like this. And this unit has about a $4 million per year positive margin for our healthcare system. So the Get Better Jumpstart is very exciting, and this is a little bit about how we've experimented with this, we've developed it, we think it's ready to go now, and we're going to do at least 4 Get Better Jumpstarts this year, so 1 per quarter, and these are the focus areas. We have readmission, value-based care, reducing the total cost of care, another similar CMS audit in physical therapy, our access center, and in emergency department flow. So very excited about the next steps of that. So as we look at, and Daniel talked about, we have a management system, and what are the results that we're getting? Is there enough to say that this is worth continuing to invest in? We believe there is. NEA Baptist leads our region in patient safety, which is first and foremost for us. We just got a Leapfrog survey, which is done for all hospitals across the U.S. We received an A grade from the Leapfrog group for patient safety, and it's the highest in our region. We're the only A-rated hospital in our region. We also received the Health Grades Award for the top 15% of patient experience nationally. So there's a national survey for patient experience called the HCAHPS survey, and NEA Baptist was among the top 15% nationally. Only 4 hospitals in the state of Arkansas achieved that, and we were one of those. This is another great example. This is the nursing team, and you actually saw Susan there in one of Sylvain's slides. She's one of our nurse leaders. My chief nurse executive is there, Paula, in the middle in the white. And these are scores. Our nursing department had the highest employee engagement scores of our entire system. And when the CNO, when you ask her, what do you attribute your engagement scores to? She has the highest nurse retention and the lowest turnover in our entire system. And you can ask Paula, what do you attribute that to? She would attribute it to the management system that we use at NEA Baptist. She attributes it to the kata thinking pattern, the idea generation that gets people engaged in the work and using the principles of respect, humility, empathy, and trust. And that's what's happened to our engagement scores in the last 4 years. Here's some other metrics that we're proud of. We talked about some this morning as well. You can see the urgent care to create access for patients that need access to our healthcare system, to create increased access points across our network. And we've done that and are in the green on that this year. Annual wellness visits is an area in the middle that we're really struggling in. We want to be here, and so we have a significant gap there in annual wellness visits. Those are preventative visits for patients to make sure that they don't need higher cost healthcare services down the road. And then reducing readmissions is a big key and a big driver for our total cost. So we want to reduce readmissions. We track that on a monthly basis and have had great success in the past year. We've also been able to grow our service, and so that's different than the Canadian system, but we can increase revenue with continued growth. So we have primary care volume is up, total patient care volume is up, and urgent care volume is up for our system. And then we have a scorecard, and these are the elements, the key elements of our scorecard at NEA Baptist, and they flow up to the Baptist Corporation as well. And so here are our results for the past year, the budget year that we just finished. Green in quality, patient experience, not where we wanted to be. We have some improvement opportunity there. Length of stay in the green. Turnaround time for admitted patients in the green. For discharged patients, we did not meet. Inpatient discharges was green. Outpatient registrations was green. Net income was green. So our management system and really focusing on the entire system to develop that deep culture of operational excellence is certainly getting results for NEA Baptist. So this is another quote that I use often with our team, and it really speaks to the importance of leadership, for leading with humility, for having empathy and having respect and care for all people. So our organization is going to erode. Only 3 things happen naturally in organizations: friction, confusion, and underperformance. Does this resonate with anyone? Everything else requires leadership. My challenge to you today is really encouragement. It's to be the kind of leader that you want to have, and to really use a management system. Think about how your management system works to create the kind of environment and get the results you want to have. We think about our work as a sandcastle. How many of you go to the beach and build sandcastles with your kids? Anyone? Some. What happens to our sandcastle? It disappears. The waves, the wind, the child running down the beach that steps in the middle of your sandcastle. We talk about this. You can use fancy words like entropy, but to resonate with our teams, we use the analogy of a sandcastle. We have to continually work on our management system. We have to continually work on the critical few things that are important to every department. And those may be different for each department, but we think about it as a sandcastle. When you're not paying attention, the sandcastle is eroding. When you're working really hard on the tower on the left, you better pay attention to what's happening on the right. And we get a lot of positivity out of this analogy for our teams. So, again, the question for you: how do you think about your management system? Here are 3 steps that I would propose. Again, this is just an experiment, but that I would propose. So, identify key systems and processes of your management system. What are you counting on to get the results you need from your management system? And just like the gear train analogy, it is critical that the systems interact. The systems have to work together. So it's not good that you have the very best system. All the systems that you use have to interact. They have to work together, and they have to make sense for your team. They have to make sense. And then finally, and most importantly, just like the sandcastle, how do you check and adjust that you're getting the results that you want, that your customers want out of your product or service? How do you check? What's your routine? What's the system that you're using to check and adjust? Now, does this process sound familiar? I hope so. Because identifying the key systems is, where are you today? How do your systems interact? What problems are you having? What are your obstacles? My guess is you have plenty of obstacles, right? There's plenty of opportunity to get to your next target condition. And then finally, how do you check your systems? You know there's going to be another target condition. How do you move forward in your thinking and mature as an organization, mature the product that you're delivering to your customers? This is a copy of my book. It was a pleasure to work with Patrick Gropp and Skip on this work. It really tells our story at NEA Baptist. And I spoke just before the program today. I think this book applies to more than just healthcare. I think it applies to anybody in any organization that has a management system at play. thank you very much for your time, and I'll have any questions. I'll stay here. I'm going to get the headset.
Alors, je vous garde avec moi, Brad. You stay here with me. Des questions dans la salle, vous avez des microphones qui vont vous permettre à Brad d'avoir l'interprétation en anglais. Il y en a un là, puis il y en a un de l'autre côté. Peut-être que pour briser la glace, c'est toujours inquiétant d'aller poser une question. Ce matin, vous avez parlé en groupe plus restreint de la recherche de l'équilibre entre ralentir, consolider les choses et accélérer, déployer, spreading. Pouvez-vous nous parler un peu plus dans le développement du système de gestion de quelle a été la recherche de cet équilibre?
Yeah, so the balance between going narrow and deep and wide and thin. So the quote that we talk about a lot is, we do not want to do training for the sake of training. We have all been in training for the sake of training, right? It's very frustrating. Very frustrating for our team. You go to a training class, you leave the class, you sign a piece of paper, and you are perceived to be proficient in that, right? I get some head nods. So training for the sake of training. We believe now at NEA Baptist, we do not do training unless we have a plan for how to enact that training. So that's our PDSA. So if you go to a Kata class, you start as a Kata learner the day after the class. So you have to have practice for whatever training you go to. And so we've tried to get away from doing hours and hours of training with our team to doing training specifically for a purpose. And so there's a balance of going narrow and deep into the organization to have real understanding of the impact of this work, and just doing training for the sake of training and staying very broad but not being able to go as deep. It's a careful balance, but it is all about developing leaders among your teams. All about developing leaders that can spread what you want to work on. So we try to go narrow and deep, and also being very mindful of the idea that we want to create a pull. Flow and pull is one of the principles that we believe in. So we're trying to create a pull in the management system by seeing people that want to go narrow and deep, and that helps us spread.
Merci. Madame?
Yes, thank you so much for your presentation.
Thank you.
May I ask in English directly?
Sure, please.
Okay.
Yeah, that's great.
Thank you so much. Very rich, so usefully illustrated. I was wondering, in Quebec, I had the chance in my thesis to study not the implementation, but experimentation of control rooms, which are lean-related performance management tools. And one of the significant tension it seems to raise is the tension between accountability and value. So through those integrated systems, how do we solve what we are accountable of and the value we want to create? Because there are some discrepancies in the Quebec healthcare system, and many can correct me. So I was wondering if you faced that challenge yourself, and how, and if so, how did you try to solve it?
No, it's a great question. We struggle with that a lot because, again, healthcare workers are passionate about what they do. They want to do a good job. They want to create value. And so we talk about that in a way of playing catch ball with departments. So our strategic deployment system allows for a lot of accountability. But somehow, y'all will have to help me, but accountability as a term carries a negative connotation. Is that right? And we believe that too. So you hear lots of organizations and lots of consulting firms that talk about holding people accountable. You have to have accountability. I believe in accountability. But you have to have a respectful way of dealing with that among your teams. And so we really try to do, through a process called catchball, we really try to talk to the teams about what is the value that they want to create. We have to answer the question, how do you anticipate creating that value? and then how can we work that into the strategy? So our strategies, our systems create that accountability. Sometimes patient experience is a good example. So we might allow a nursing unit to do experiments to improve the patient experience. But there's an accountability that they will do what they say they will wanted to do. They will run the experiments, and we will together look at the outcomes. Did they make a difference in the patient experience scores? That's really helpful when dealing with our teams.
Thank you so
Thank
much.
you.
Monsieur? Merci.
I would like to talk about the OBEA room.
Yes.
How does it work with the customers? When he arrived and when he get out of the hospital, I would like to know the frequency each day, who is there, and how do you cooperate the physician?
Yeah, very good. So the frequency of the OBEA meetings change based on the level. So our health system meeting happens monthly, once a month in the OBEA room, and we go through all the strategies. And so that meeting usually lasts 45 minutes. We like to immediately after, we like to go and connect that dot into another department. So we like to travel to the Gemba to see another department and their activity. For the departments, they meet on a weekly basis. Many of our departments in healthcare are 24 hours a day, have night shift, evening shift, and so they do weekly huddles to make sure that they capture all of their employees over the course of the month. And so at the department level, you're going to see a weekly meeting. And then on a daily basis, there are daily huddles that occur that allow for good communication among teams, prepare in advance for what the day is going to look like, how many patients are on the floor, how many patients are discharging, how many patients were in the emergency department last night. We also do an organization-wide daily huddle where we talk about all those key metrics, and every department reports out of their activity in the last 24 hours.
Okay. Can I ask?
Yes.
How do you how do you monitoring the time that the client stay in the bed and go to his examination or room operation? Do you chart it on the OBEA?
Well, yeah, so one of our key indicators that I mentioned was the length of stay in our hospital. Is that what you're asking?
Yes.
Yeah, so our length of stay at NEA Baptist, we were talking about this last night, I believe, but 3.2 days is the length of stay in our hospital. And so the key systems, the key departments in that, case management is a set of nurses that help discharge planning, and then our hospital physicians, our hospitalists, are key in managing length of stay. So we've engaged and aligned those groups as key indicators of how we manage the patient flow through the organization. Another key element is the emergency department. So what is the volume in the emergency department? How many are anticipated to be admitted into the hospital? And so those systems have to interact as well.
Okay.
Merci. Madame?
Bonjour, hi. Je vais éviter un moment très gênant. Est-ce que je peux poser la question en français?
Yeah.
Donc, merci déjà. Je me demandais simplement quel a été l'élément déclencheur ou la personne déclencheuse du kata au sein de votre organisation.
Yeah, so when we moved, we had an 88-bed hospital. In January of 2014, we opened a 228-bed hospital. And so, again, we talked about a new hospital solving all of our problems, but we got into the new hospital and the processes were broken. Patients were frustrated. Employees were leaving because the systems and the processes wouldn't work. And so Kata came as a real element of we had to have it. We had to be able to, on a daily basis, iterate our thinking and improve what we did. So we reached out and got a lot of help with Kata. We had help from several consultants that helped us begin start Kata boards and train in Kata. And then through a lot of networks, KataCon, a lot of folks that Sylvain mentioned, we're not using any consultants anymore, but we did for a period of about 3 years to really help embed the Kata thinking into the organization.
J'en ai une
Thank you.
dernière.
Vous avez une autre question?
Une toute dernière.
Yeah.
Selon vous, dans votre organisation, est-ce que vous pouvez dire que c'est un esprit qui est démocratique ou plus une figure d'autorité, entre guillemets, se met en place pour vraiment faire régner l'esprit Kata?
Yeah. Yeah. Yeah, so we talk about it bottom up or command and control, top down. I believe there's a place for both. There's sometimes from a safety aspect that we have to do things and it has to be top down. But there's lots of work that we do on an ongoing basis that is better, is more sustainable when it comes from the bottom up. So it's our job as leaders, I believe, to help align that with key departments and help get that thinking pattern to develop and grow in the organization. So we believe that happens with the kind of culture that we talked about, the culture that's based on principles. And so today in our organization, we still have command and control leaders, but we have less command and control leaders than we did 5 years ago. So there's more of a spirit of experimentation as we grow and develop.
Merci. Madame?
Hi.
Hi.
I was wondering, how do you plan the resources to support the experimentations? And I'll explain my point by saying that when I was working in manufacturing, we had resources if we needed to move a machine or to redo a production line. But in healthcare, and especially in Quebec, when the resources are scarce, how do you make sure that people are enabled to perform their experiment?
Yeah. It's a great question and one that we struggle with, but probably not as much as here in Quebec, the struggle there. But what we have said to leaders in the organization, if you're a leader in the organization, improving the work is the work. So as a leader, it's your job to help improve the work. And so we have again created a pull there. We ask for people to be involved in the shepherds groups. We ask for them to be involved in meetings and planning. And what we've created is a group that people want to be a part of. So people are saying, yeah, I would like to attend this meeting. I would like to be part of this team to help improve the work. So again, I think it goes back to we've created the culture where people want to be involved in that. Our struggle is more for salaried people. The improvement work is still for more salaried people. So hourly workers, it's harder to get hourly workers involved in that because they have a job that they have to do on an hourly basis. But even then, for key meetings, we encourage our leaders, if we have a manager that says, I need these people on this team to accomplish this obstacle or to get past this obstacle, we approve that to make sure that we want to know where they're going, how they're going to get there, and we have accountability on those results. But we allow them to get that team involved. Thank you.
Thank you.
Monsieur?
Well, thank you, Mr. Parsons, for your excellent presentation. You're the CEO of a faith-based organization, which is part of a faith-based network. So I would be interested to get your views. To what extent does that character of your organization give you an advantage or facilitate getting the commitment and the engagement of employees over time to achieve your higher goals?
Yeah. It's a great question. I've worked for the Baptist organization for the last 12 years. I'm proud to work for the organization, and I'm proud of its faith-based mission. That's important to me personally. And so it's something that I hold dear. I do think it helps with our mission. I think it helps with the deeper desire to take care of people. But I think that is true of all people that work in healthcare. And so before I started with Baptist, I was in an organization that was not faith-based. And the people there were just as passionate about the care of their patients as the people in a faith-based organization. So I believe healthcare is unique. And I believe this applies to lots of different industries. But I believe healthcare is unique because it taps into the people that get into healthcare. Think about the training. Think about the years of training that people go to be involved in the healthcare system. Physicians, nurses, physical therapists, years and years of training to be involved in healthcare. Many people from a young age say, I want to be in healthcare when I grow up. So I believe healthcare has the unique opportunity to tap into really the service orientation, regardless of a faith-based mission, which is, again, is important to me. But regardless of that, I think there's the opportunity to connect to continually improving care for the patients that we serve.
Quelqu'un d'autre? I will ask you a question on a different way. My boss asked you this morning. What would you tell to the young Brad Parsons after those years of
Yeah, so some would say I'm still very young, right? But to the young Brad Parsons, I would say to get started today. Don't wait. I think of the John Shook quote that I shared. It's easier to act your way into a new way of thinking than to think your way into a new way of acting. So get started. Regardless of where you are today, regardless of how many people that you truly believe in what you're working on, start somewhere. Start with somebody that's passionate about it. Start with somebody that has a lot of, that wants to do a big project. Start with somebody that is adamant that they can do something better. Just get started today. When you have it into a system construct, when you put it in a management system, you give people something to see and hold on to, it will spread. And it spreads a lot faster than we even think.
Brad Parsons, thank you very much.
Thank you. Thank you. Thank you.